All right, good morning, everybody. We're going to go ahead and get started. Welcome to our March Utah Children's Care Coordination Network meeting. Hopefully, everybody is having staying at a good temperature with all the back and forth with weather these days. Um, all right, we're going to jump right into our agenda. So we have some time for announcements, and then a resource highlight from Take Care Utah today, and then our learning session will be from the Utah Community Justice Advocates program. Oh, if you haven't had a chance already, we'd love for you to rename your profile in the top right. If you hover over your picture, the top right corner, there's three little dots. You can select to rename yourself. I need to do it myself here. And then that helps us keep attendance for this meeting and also keep track of anybody new that's attending. If you are attending for the first time, we'd love to have you introduce yourself in the chat, including your email address so we can add you to our listserv. You'll be added to the meeting invites and then get announcements throughout the month as we meet as well. All right. Next, we will jump into announcements. I don't have any. Does anybody else have any that they'd like to share with the group?
This is Dora from Shriners.
Hi, Dora.
Hello. I've just a reminder that I met with our manager that's over the physical uh rehab department, so that's physical therapy, occupational therapy. Um, just reminding everybody if any of their patients need either service, that they have openings their schedule, they can schedule them out in 2 to 3 weeks. So I will send a little flyer as a reminder so you can see everything they treat. Really just anything orthopedic and neuromuscular. But yes. And a follow-up on the wheelchair department. They are seeing they're doing evaluations for evaluations. They are having them with the other physical therapists that are there for traditional therapy are doing those evals as well. So that's continuing um, as well. So if you have any other questions, I'm the liaison. And when I send that email, feel free to respond. I'm happy to answer any questions. Thank you so much.
Thanks, Dora. I can see that Haley Henderson also put in the chat the new case management training schedule. Haley, did you want to say anything about that?
Yeah, I put up the wrong link, so I will fix that. But the case management training is open to anyone and everyone wanting to learn about those topics. So feel free to attend. There are CEU credits if you would like credits, learning credits. So I'll fix that link.
Great. And I'll get that link as well as the flyer that Dora sends up on the Trello board as well for anybody who's trying to find those resources after the meeting. Any other announcements? Right. We're going to start with our resource highlight from Take Care Utah. I'm going to turn the time over to Daryl, who's the executive director there.
Hi, good morning. I'm going to try to share my screen. Just give me a moment. Can you see that? Awesome. Thanks so much. My name is Daryl Hershaft, and I'm the director of Take Care Utah. So wanted to talk to you a little bit about what Take Care Utah is. So we're a nonprofit organization. We provide actually, the umbrella organization is called Utah Health Policy Project. And it was founded about 20 years ago to help make health insurance more affordable and accessible to Utahns. And one of the ways we do that, we have some work on Capitol Hill, but another way that we do that is through Take Care Utah, which is our direct service program that provides hands-on assistance to people to get them enrolled in whatever health insurance that they might be eligible for. This is mostly around Medicaid and all of the various different types of Medicaid, CHIP, and our marketplace coverage. Take Care Utah is the only nonprofit coverage in the state of Utah. So our brokers who help people join marketplace plans do not see commissions. So we're here to just help people with the needs that they have. All of our services are free. We have offices in Ogden and West Valley City. We had one until a week ago in Provo, but now we need to find a new space. We also assist people virtually. So on the screen there, you can kind of see a snapshot of what we do. So we meet with people, understand what their situation is, their income, their households, identify what they're likely to be eligible for, and then we help them complete the process. So we'll fill out the Medicaid application. We become an authorized representative for clients so that we're able to speak to the Department of Workforce Services on their behalf, able to look at their My Case page, where their application is. And we sort of case manage that process through an eligibility decision. A lot of the folks that we work with have been historically underserved. We work with individuals who are experiencing homelessness or who are involved in the criminal justice system or have complicated disability cases. These are cases that without our help, folks might not be able to complete the process, whether it's too complicated or they don't have the appropriate access to a computer, or they work 9 to 5 when DWS is open. Once we are able to get folks, do you have staff that speak other languages? Yes, we have about a third of our staff speak Spanish. We also utilize a translation service that has over 100 languages. I actually believe it's the same service that University of Utah Health uses. It's a translation service that has like some specialties in health insurance language, and healthcare, that kind of thing. Anyway, once we're able to get somebody approved, we can help them select a plan, let them, help them understand how insurance works, how to use it, how to use their benefits, if they need help finding a primary care physician. Those are sort of the final steps that we take. In addition, we help with renewals and reviews and other things to maintain coverage. So you can see there in the lower right, this is 2004 data. We helped about a little over 11,000 people all over the state. We had about 3,500 virtual appointments. We have, I'll just stop there. So out of those 11,000, we had 9,800 that were approved, which is a really high percentage of approvals. And this is essentially because we've been doing this for a while. We understand what the Department of Workforce Services is looking for. We're able to help clients set up the verifications that they're going to need down the road so that we can get the application approved. And then that last digit there, 2,100 people who we helped who needed some assistance finding a primary care physician or getting connected with care. And we do that piece of it as well. So we have, as I mentioned, we have an online virtual presence, but we also go to different in-person enrollment sites. And so this is a smattering of partnerships that we have. But essentially what our staff does, we have about 20 individual enrollment assisters. We work with these partner organizations to kind of embed our services in what they're doing. So we work closely with the University of Utah to, for example, if someone goes to their emergency room and doesn't have insurance, they will receive messages from the university immediately following that to contact us. We have had quite a bit of success with that. One gentleman that we helped, his name was Ben. He went to the University of Utah emergency room because he needed a prescription refill. And didn't have a doctor, had no idea how to get one, didn't know that he was eligible for insurance. And we were able to connect with him. Another was a woman who had a disabled daughter, and she was struggling to complete the application. Disability applications are particularly complex. She was sort of struggling not only with her own work schedule, but also with trying to let her daughter, experience some independence. So giving her some freedom to try to do the process for herself. And the result was simply that they lost track of it a number of times. So we were able to step in and become the authorized representative, connect with people that way. I forgot to say, if you have any questions at all, please don't hesitate to raise your hand or ask. I want to make sure that I cover important information that's important to you. So this is our organization, and I wanted to give you just a sense of sort of where we are physically. I think I saw a question in the chat about are there plans to expand in-person sites to rural Utah? Our in-person enrollment sites, we do have plans. In fact, there is in the federal bill HR 1 that just passed, there's the Rural Health Transformation Fund, which is a significant sum of money that Utah just received, about $200 million. And there's a pretty thick proposal about the different programs that they want to begin to enact around rural healthcare. So we're actually hoping to become part of that. We're also potentially working with other nonprofits or organizations to do a proposal together. So there's like a nonprofit clinic in northern Utah that we may be able to assist with that. Let me just see here. Any questions at all so far? So for now, everything is sort of the status quo, excuse me, as it has been for, I guess, since the end of the Medicaid unwinding, or the emergency period during the COVID pandemic that allowed people to stay on Medicaid regardless of their income or any other circumstances. When that was shut down, we had a big, we had about 150,000 people in the state of Utah lost their insurance. Going forward, beginning, a lot of these things will be beginning in 2027. There are changes that will make it more difficult for people to complete the process and to get approved. And so that is something, frankly, that our organization was built for, whether we intended it or not. We are likely going to be called upon quite a bit to help with these changes. So just so that you're aware, some of them are the reviews will switch from an annual basis to every 6 months. The big one is work requirements or community engagement requirements. These will start to take effect in January of 2027, but people may need to start complying with that as soon as December. There's still some things that need to be worked out at the state level around how far back they're going to look for the work requirements. But essentially, individuals would be required to spend 80 hours a month working or volunteering. There's exceptions for going to school, for caregivers of children, I think under the age of 7, possibly 9. I could be wrong about that. Gosh, I lost my train of thought. Sorry. So, oh yes. So exceptions, substance use disorder, things like that. But the important part about that is that individuals will have to proactively look and try to get an exception. So it adds another bit of paperwork to the process. So a couple of other items to be aware of that are coming online soon. Again, I recognize this is more geared toward children, so this may not be as relevant, but there's a new 1115 Medicaid waiver that's going to allow individuals leaving incarceration to leave with Medicaid in hand, to actually have had Medicaid for 3 months while they were incarcerated. So essentially to help people re-enter, with a leg up, already having insurance, having providers, substance use providers, having 30 days prescription when you leave. Other work is the housing related services and supports is another big Medicaid program that will provide case management to help individuals find housing. It also provides a $2,000 stipend to individuals to help pay for things that they might need in order to enter a house, whether that's furniture or paying off old electricity bills to get the new electricity connected, lots of different potentials. Later this year, it's also going to include 6 months of rental assistance. And as I mentioned earlier, coming out in the next couple of weeks is going to be the initial rural health transformation funding to begin putting those dollars to work. And there's, like I mentioned, a large kind of group of services that all of that includes. So I wanted to just talk to you a little bit about how to get in touch with Take Care Utah. So that's our phone number there. takecareutah.org/bookings will take you directly to a online appointment site. You can make virtual appointments or in-person appointments at our Ogden or Salt Lake office. You can select your language. You can also let us know what's up, if there's any additional information that you might need. So that's a really effective way and that QR code there takes you directly to that bookings page. We also have, just as an aside, a linkage coordinator project. This is for people who have intellectual and developmental disabilities, where we work to connect them with preventative care, making sure that they have all the preventative services that they need. So that is another program that we also help with. I put our email addresses there for me and our 3 managers. We've worked closely with Lauren Pierce at Early Childhood at the Department of Health and Human Services. We've done some training around the state to help community health workers understand some of the basics of Medicaid and how to help people. It is extremely complicated. Our staff take probably 6 months to get trained. And so we recognize that not everyone is going to be able to have this much time to help folks. But if we can sort of equip as many people as possible with some of the basic information about who's eligible, how it works, and how people can get assistance, I think that's going to be important to have more voices across the state as we enter what is going to be a very challenging time that's likely going to result in a lot of folks losing insurance. So I know that was a lot. That's all I have for you. If do you have any questions at all? We do work closely with CHIP, as well as we've assisted some people with the medically complex children's waiver. One of um, the one thing that survived this legislative session was the state CHIP program. So that is still intact, and that is a program that allows that gives CHIP to individuals who do not have legal to children who do not have a legal status in the country, and so that's still in effect in Utah, and that's up to 2,000 children each year can be covered on that. So I think with that, I'll just stop and ask if there's any questions or if there's anything else I might be able to help with.
Thank you so much, Daryl. I think all the questions, let's see, it looks like there's Lauren just said that she's still doing Medicaid trainings for care coordinators and anyone working with families through the process. So she'll send a flyer as well about a more in-depth training that's available. And I'll get that posted on the Trello board as well. That was a really great overview of what Take Care Utah does and goes along with our theme today of like community factors that influence health. Access to health insurance is a big one. So we're glad you could join us today, Daryl.
Yeah,
If anyone else, yeah, does have any questions, you can go ahead and put them in the chat. We'll try to filter them through. But I'm going to turn the time over now to Haley Cousin, who is from she's the Executive Director of Community Justice Advocates of Utah. And she leads community-based programs that expand access to legal help across Utah. Her work focuses on training, supporting, and empowering non-lawyers who provide legal services to survivors of abuse, tenants, and those facing medical debt. And I've spoken with Haley a few times before, and I think you'll find she has a lot of really great information about advocacy and particularly around housing and medical debt, which are also things that impact people's health. So she's a member of the Utah State Bar and serves on the Utah Supreme Court's Ad Hoc Committee on Regulatory Reform as well. So we'll go ahead and turn the time over to Haley.
Thank you, and thanks so much for having me. Excited to be with you all this morning. I also invited Antonio. I think I saw them on. They are a professor of practice and community legal education lead at Innovation for Justice, and we will talk about our partnership during the next little bit. Today, we're going to talk about an overview of what community-based justice work is. What are these words that I'm saying? We'll do an overview of our 3 different community justice advocate programs and then talk about how to get involved and make referrals to individuals in our network. So, I want to get started with providing an overview of the work we're engaged in, which is this emerging term nationally is community-based justice work, and it's the delivery of legal services in the communities rather than maybe from traditional legal providers. This came about because we're experiencing nationally, but also here in Utah, an access to justice crisis. This means that the people who need legal help aren't able to get it. Nationally, low-income Americans didn't receive any or enough legal help for 92% of civil legal problems. So that's things like eviction, protective orders, debt, any civil non-criminal matter, which means they're making decisions without information about their rights and their options and what can be done. Here in Utah, on the right side of the screen, we have some Utah-specific facts. In debt collection cases, only 2% of debtors have attorneys, where almost all creditors, like to the point where we can say 100%, were represented. They did have legal training. They knew what was going on in the process. In eviction cases, 95% of tenants had to represent themselves. So only 5% had attorney representation or attorney help, compared to 90% of landlords had an attorney. And then in protective order cases, numbers are a little different. 53% of survivors had to represent themselves, compared to 70% of respondents. So we knew that this was a big problem. We knew people were having huge cascading health and financial effects. So our Supreme Court said, let's do something about it, and created what's called the Legal Regulatory Sandbox. The way I explain this is the sandbox is a place we got to play with the rules around the practice of law. So our program specifically played around with who's allowed to practice law. Previously, it was attorneys, 3 years of law school after 4 years of post-secondary education, followed by a bar exam, working in a firm, very inaccessible, very limited. We also had in our ecosystem, right, legal navigators. They existed already. These were people who are trained to identify legal issues and say, here's some legal information, here's a referral to Utah Legal Services, Legal Aid Society. We created a new class of legal helper, called community justice advocates. These are individuals, frontline staff at community-based organizations who are trained to provide limited scope legal help, which means focused legal help, with attorney support alongside existing health, human, and social services. So we are integrating legal help into existing ecosystems, existing systems of care, so that people can access not only, rental relief funds, but also the legal advice concurrently, and they can decide, how do I want to solve my problem? What tools do I want to use? There's a slide a little bit later in the presentation that goes over our partners, but we have about 40 community partners statewide, and right around 70 advocates who are either actively providing services or who are in training across our programs. So, what are our programs? Okay, so our programs are targeted at empowering communities. So, you might hear me refer to the legal empowerment cycle, which is we need to know the law so that we can use the law so that we can shape the law. Our programs live in the know the law territory. We're doing trainings in areas of law where the community has asked for additional support. We're not getting support. We're not able to provide services. So we've built out different trainings. Our advocates then go out into their communities to provide services and community legal education so people are able to access and use the law. Shaping the law is outside the scope of what we're doing, but this is the work of communities to cause systemic change and to make laws more equitable. So this is what we are trying to affect long term. So our first program is housing stability. In 2025, we had 7,981 eviction cases filed in Utah. This means that we had about 7,500 Utahns who were evicted or went through eviction proceedings and had no legal help to understand their rights and responsibilities, to potentially stay housed longer, or hopefully to reduce the financial impacts of an eviction. In Utah, if you stay past that 3-day pay or vacate notice, you start incurring treble damages, which means every day you stay, you're incurring 3 times your rent. So whatever your daily rent would be, you're incurring 3 times in fines and fees. Eviction, we know, has short and long-term effects on children specifically. They're more likely to be chronically absent from school, switching schools, which leads to learning and social disruption, and they have a reduced likelihood of graduating from school. Um, on both children and adults, eviction has lasting health impacts. So while the potential mental health impacts are certainly more visible and more talked about, there are physical health risks too, including worse caregiver reported child health, adult higher all-cause mortality, and worse self-reported physical health. Evictions are also tied to financial instability, so the inability to make rent many times, and to misunderstanding of renter and landlord rights and responsibilities. Given that, this is the goal of our program. And Antonio, if you would like to talk about this one.
Yeah, happy to. Am I coming through okay for everybody?
Yes.
Hello, folks. So yes, thank you, Haley. So our programs are intended to train folks across the full lifespan of a potential civil legal issue. Whether folks will get into this, how people tailor scopes and how they, actually use these services or deploy them in community. But at the training stage, we make sure that folks understand and appreciate the full lifespan of a case, right? And that's so that when they're interacting and supporting community clients, they can give that holistic support so they know what the next timeline and the next pieces of the process are to effectively provide legal support. And so the first bucket of that training and then associated scope is pre-eviction. We train folks to support community clients in avoiding court-involved eviction and keeping clients housed. We support folks in helping clients navigate eviction, so mitigating or decreasing the negative consequences of the eviction, and then post-eviction, increasing housing stability by closing and sealing past eviction cases. So that associated training scope becomes their practice scope. So they could provide legal advice regarding housing matters, including issues of habitability or DV and lease termination. They can advise on the rights and responsibilities of tenants and landlords based on the tenant's specific facts of their case, the lease, and the law. They can advocate on behalf of tenants in negotiation processes with landlords. This is different than mediation and arbitration. We'll talk about all of those things later. Um, they can explain and assist with the eviction court process, including assisting with forms. And they have a quiet seat at the table, at council's table.
Any questions on this program before we go on to the next one? We can always circle back if you think of something. Okay. All right. Our next program is medical debt legal advocacy, which ties in really well to what Daryl was talking about earlier. We know that medical debt is a significant barrier to accessing additional health care, and that delaying or foregoing care and medication can lead to worsening physical conditions and higher mortality rates. Even if care is not delayed, debt can cause financial stress, which can lead to anxiety and depression. We know that families facing medical debt may also be navigating housing and food insecurity, right? All of these problems are connected. And so, how can we provide more comprehensive, holistic care? So, turn it back to you, Antonio.
Absolutely. So again, we train folks on that full span of the scope. So pre-court all the way through post-judgment. At the pre-court stage, we're training folks on how to support clients in avoiding court-involved collections and reducing total debt. At the case kind of navigation stage, mitigating or decreasing the negative consequences of that case and medical debt. And then post-judgment, increasing financial stability by addressing potential garnishment or judgment outcomes. So then the associated scope of that is that folks are trained to be able to give legal advice regarding the collections process and their options for debt resolution. They can advise their clients on the rights and responsibilities that they have as patients, and how that works and is relative to the provider. They can advocate on behalf of clients in negotiations with service providers and debt collectors. They can explain and assist with that collections court process, including the filing of forms or the assistance with the filing of forms. They can provide guidance on limited related matters, such as potential eligibility for public benefits. And then they can explain credit reporting rules and how to correct credit reports on that outcome stage.
And then our third program has to do with protective orders. Interpersonal violence and stalking also pose health and safety risks to victims. We know effects can range all over the place, right? From injuries as a direct result of abuse, we have unwanted pregnancies, emotional distress and fear, traumatic brain injuries, and sometimes even death. Children who witness domestic violence experience elevated stress levels. This can impact cognitive functioning long term by impairing normal brain development. Can also lead to emotional distress, delayed development, and more. They're also more likely to experience substance abuse, criminal behavior, suicidal ideation, and to perpetuate the cycle of abuse as they reach adulthood. Our goal with this program is to put a stop to that using the legal tool of protective orders and stalking injunctions. This program, similarly, we are trying to help with the entire protective order process. So, advocates in this area are able to help determine eligibility, likelihood of success, create a plan, while also looking at are there other tools we can use, right? Is a safety plan more appropriate in this time? Is a report to law enforcement most appropriate this time? What is the right tool to use? And then with the protective order process, they're able to draft the documents, help clients prepare for hearings, and then also they have the quiet seat at the table so they can attend court with their clients, sit with them. They're not presenting the case to the court, but they're able to provide kind of quiet promptings and support. The client journey is how a client is existing in the system and experiencing legal services. So, where traditional medical legal partnerships involve some training of medical teams, medical staff to identify problems and then refer them out to a licensed attorney, some agency partnership. This is embedded directly within the care they are receiving. So, a client will present to a community-based organization, and at intake, they identify there's potentially a legal issue that we can help with. They then meet with the advocate who goes through the case, decides if they can take it. They then deliver services directly. They manage their caseload, they manage communication and case status, and deliver services all the way through. We defer to our community partners for eligibility standards so that they can be responsive to their community need. They can be responsive to what their grant or other funding restrictions are without facing additional restrictions from us. They also are trained on how to provide referrals if something is out of scope or they cannot take the case. And then Antonio, I'll let you talk about the advocate journey.
Absolutely. So it's a little bit of a kind of complementary story that's happening, right? So advocates will apply for our program. So interested and eligible frontline staff will submit an application to Community Justice Advocates of Utah and our organization, I4J. Um, we'll meet with that organization and the eligible advocate to ensure that they're set up for success, that they understand what the timeline is. We'll talk a little bit more about what that timeline exactly is right after this, but ensuring that they understand that this is deep legal skill building and training, that this is a little bit of a reimagining of their current scope, so that they're able to then prioritize some of that upstream intervention rather than just taking a totally new job, right? We're embedding the civil justice problem solving in the work they're already doing. Once we all have the green light, everyone's giving thumbs up. Yes, I want to do this. Folks engage in right around 50 to 60 hours of online legal education, learning the substantive law in one of the two or one of the three practice areas that they'll be training in, the procedure associated with the processes they'll be helping folks with, and then the skills needed to effectively deliver legal help. The courses blend synchronous and asynchronous content and elements, including real-time synchronous meetups or skill building practice. And then not if, but when, we always tell folks they finish the course, they're certified by CJAO to begin providing limited scope, focused forms of legal services to their community clients. Advocates deliver services managing their intake, eligibility, and caseload. I'll explain why we're specifying that part in a second. But then they report information on clients and services to CJAO each month. So why do we kind of call out that service delivery? Well, it's because here, the brown box at the bottom, we were really layered on as service support, right? We are not the ones that are selling eligibility standards or criteria. We are not the ones engaging in the case management of the work that folks are doing. We're not telling them which cases to take and how to do it, right? Our role is really to champion and to mentor. So advocates have an associated attorney mentor to call if questions of law or ethics ever arise. They report data to CJAW about services to allow ongoing support and program oversight. Advocates engage in ongoing legal skill building through CLE, continuing legal education, or CEU style trainings. Those are held quarterly and tailored to the needs of the advocates in our programs. And then they attend optional quarterly roundtables to network and develop solutions. So again, we're here to really help force amplify the work that they're doing rather than to kind of act as kind of the central service provider ourselves.
Yeah. And one thing I would add that we've both kind of alluded to is that these programs are meant to upskill in existing employees, kind of reimagine their role. We have advocates in our network who are trained and they may help 3 or 4 people per year. That is wonderful. That is 3 or 4 more people who have access to their legal rights and options than we had before. We have other partner organizations who have reorganized so that, they have a full-time legal advocate at their organization, or at least that's a significant portion of their role. We kind of have the whole spectrum, but we work with our partner organizations and the advocate themselves to determine what this will look like for them, making sure that it works within the organization's existing structure. We're not trying to force like a new program on anyone. With all of our programs, all of our advocates receive the whole scope of the training, but they are able to tailor service provision. So, if they're get trained in housing and they say, well, we don't have time or bandwidth to go to court, that's great. We just want to help upstream and we're only going to help with, before they have the notice to vacate, everything upstream. That's great. We're working to enhance the services you already offer in your communities. So, how to get involved? You can join the network. We do take rolling applications for our housing stability and our medical debt program, and we build a wait list out for our protective order program. We currently have a cohort in training right now. They will launch in about a month or 2 months across all of our programs. And then we will also do a cohort in the fall. I have dates TBD. Antonio may have more solid idea of what TBD is, but it's generally late August, early September start. So if you're interested, please do reach out. You can submit an application. An application is not a firm commitment. We are not locked in at that point, but it does open the door for us to be able to start meeting with you and your organization and figure out timing, and bandwidth and all of that. Anything you would add there, Antonio?
No, I think one of the biggest conversation points that we have with folks who apply or who are interested is just getting a better understanding of how this would fit within your existing scope of services at your organization. Or if you know someone who knows someone who might be a great fit for this, please reach out. Feel free to schedule a one-on-one with us. We're always more than happy to have that conversation, but also to brainstorm together, right? Some of the most fun, I think, I'll speak for me, Kaylee, is the recruitment combos where we're looping in like everyone from all kinds of departments to kind of figure out what would this actually look like in implementation, right? Like how would we make this happen? What would outreach look like? Who on our team is best fit for this? So any of that kind of initial intro conversations, we're more than happy to have.
Yeah. Yeah, I love those conversations. And also, like, it's a bummer when an org says, we don't think this is right for us, but let us connect you to our referral partners. We really love working with these orgs and they may be set up to do this better. We've found a lot of our partners that way. So if you're sitting here thinking, I do not have the time, I do not have the resources, people on my team do not, we often refer out to this organization, our community. Let us know. We'd love to have a conversation with them. As promised, a little look at our network. Currently, our organizational partners, we have about 30% are domestic violence and sexual assault service providers, about 30% are government, and those are generally police departments and prosecutors' offices who have victim advocates who are providing support for protective orders. We have about 12% housing and homelessness orgs, almost 25% human and social orgs, and around 3% other. Around 50% of our partners are located in and serve primarily urban areas, but we do have 38% who are located in and serve rural Utah and 11% who serve statewide. That is a little bit of a misnomer for what's actually going on in the network. So I also like to show this client location. We have 70% of our services are delivered to clients who live in rural or frontier Utah, because there's no services. There's no services for them to access. So we have spent a lot of time making sure that these partners are well equipped and confident and able to provide these services so that they can not only fill that gap, but kind of create the first kind of service provision local to their area. And then we have 30% of our services in urban areas. If you want to find an advocate, make a referral, you just go to the CJAW website, cjow.org, and at the top there's a button that says Find Help. On that page, we list organizations who are accepting outside referrals. We may have more CJAs in our network. We do have more CJAs in our network, but some do not have the bandwidth or capacity to take those outside referrals. So if you go there, you can see the CJA. You'll want to contact them for their eligibility requirements, but that is how you can make a referral out. I think that is it. Here's our contact information, but we are happy to answer any questions that people may have.
And then just flagging, I put that exact link that Haley was referencing about finding help in the chat.
Thank you.
I was just looking on your website on the Find Help. I think that's really great that you've listed the agencies in the areas that are accepting outside referrals. Do you guys have any experience, or are you currently training anyone in medical settings? Just curious on that.
We are doing a lot of work to identify partners. We've had a lot of conversations and they've gotten pretty far, and I'm not going to say with who,
Sure,
but
sure,
we
sure.
especially are interested and would love to support different community health workers in this work. The closest we have are two community health workers with Holy Cross Ministries. They are not accepting outside referrals, that's why you didn't see them there.
Sure.
But they are providing medical debt legal advocacy services, and have been really, really successful.
Great. Well, I think this is a good audience. We have a lot of people representing different health clinics and practices on this call, and I know clinical offices are very busy, but it just seems like such a good fit for some of the work we're already doing around care coordination, or if social needs are identified at a clinic, which is in a lot of practices, a standard screening tool, right? It would make a good fit for somebody in-house to be trained on some of these areas, and they could provide that help right there instead of referring out to an outside agency as well. So
Right.
anyway, I encourage everybody to think maybe about if this would be a good fit, if you're especially in your care coordinator role, if this is something that you could um, take on as well. Yes, Antonio, did you have something else to add?
Yeah, if I could just add super quickly. Thanks so much, Alina. We recognize that the community health workers and care providers, people who help folks in receiving services and care in general, particularly right now, are wearing 5,000 hats at any given point. So I want to underline and emphasize one more time a point that Haley had made during the presentation, that there is no service quota for the programs. So if as a result of participating in the program and getting the certification, you help one client a year with legal services, right? Um, that works for us. We don't want to set any kind of eligibility, service, time, or labor requirements on the programs. One of the last modules that folks complete in the online course is about burnout, right? We recognize that the turnover rate and burnout in our professions collectively across care sectors is somewhere in 20 to 40%, right? The legal sector, also high. We have no interest in replicating forms of burnout. So our goal is building a kind of more robust, maybe better prepared and supported form of legal help in our state. So if you're interested even remotely in learning a little bit more, let us know. We're happy to chat.
Thank you. What questions do we have for Haley and Antonio? All right, I don't see anything else going up in the chat or on the hands raised or anything like that. So we'll be sure and post your contact information and slides and everything on our Trello board. That's where we keep all our resources going. So we have a little bit of time. I would love to open it back up for, we haven't had a brainstorming session in a while. Um, if anybody has a case that they want to bring to this group, this is your time to share. I'm going to bring my screen back up. All right. Anybody have a difficult case you're working with or need advice on a referral? Any barriers you're encountering that you want to bring to this group to talk through? I know we've had a little bit of activity on the listserv this last month, which has been really helpful. People. Just got a quiet group today, huh? That's what's happening. All right. Well, we'll wrap it up then. So our next meeting is going to be April 15th. Our reader presenters will have our autism mini module again from Sylvia. She'll be presenting to us that month, and then in addition, we'll have a highlight from Comprehensive Care Clinic as well. So as always, we encourage you to stay connected on the listserv if cases especially do come up and you need assistance with them. You can send it to the email address you see there and then on the Facebook group as well. So thanks everyone, and we'll see you next month.